The story of the American Indian is filled with historical myths and modern-day truths. Today we'll explore the truths and explode the myths of this fascinating and resilient community, who have specific challenges that are direct products of their culture, biology, history, and policy. Myths and truths, unique mental health issues of American Indians. This week on My Healthy Mind. Let's talk about it. Welcome to My Healthy Mind. I'm Michael Hunter. No doubt most of you watching have certain defined mental images of what the American Indian culture looks like, and while some of those ideas may be historically accurate, today's reality is likely far different. Contemporary American Indians have a proud and storied past as first on this continent, a history full of wondrous achievements and horrific tragedy, all of which has made them the strong, vibrant people they are today. But it also gave rise to several health and societal issues that no other group faces. But like every modern culture, American Indians are actively seeking answers to help their own people and enlighten others. Let's begin.
When I go around and talk to different groups in Michigan, they're surprised that there's an organization in Detroit. And they're like, are there natives in Detroit? I'm like, yeah, there's natives in Detroit. There's a lot of natives in Detroit. But sometimes it's hard to tell by looking at us. We don't have a specific part of town that we live in. We don't have our own grocery stores or our own churches in the town. So the visibility is kind of low. And so people really just don't realize that we're here.
Today, my colleague Elizabeth Atkins will be speaking with Ashley Tuomi, CEO of American Indian Health and Family Services of Detroit, and herself a member of the Confederated Tribes of Grand Ronde in Oregon. Ashley is in the unique position of having experienced firsthand the life and special challenges of being an American Indian, then taking that experience to effect positive change in the lives of those living here in Detroit.
Ashley, welcome to My Healthy Mind.
Thank you.
I have so many questions to ask you. You're doing some wonderful things here in the Detroit area, and your personal story is fascinating. Can you tell us about your background growing up in Oregon as an American Indian as part of the Confederated Tribes of Grand Ronde?
Yeah, well, actually, I was an Army brat. My dad was in the military for 21 years, so I actually traveled throughout the country a lot before I actually settled back in Oregon and got involved in the reservation. I was probably about 12 or 13 before we moved back to Oregon, and I started getting more involved and became royalty with my tribe and traveling with our color guard and representing the tribe through our royalty program.
What does royalty mean?
It's like a pageant for Native Americans.
That must have made you feel really proud of your culture.
Oh yes, I got to go through a lot of different powwows in different states. I got to go to the state legislator meetings and represent my tribe.
So can you give us some specific examples of mental health issues that you might have witnessed and how they can illustrate the prevalence of the problem?
Yeah, so alcohol and drug abuse are very prevalent. A lot of that can stem from mental health needs and the trauma that people have experienced. But alcohol specifically is really prevalent in this community. I was recently looking at some numbers, and the actual rate of alcohol use is lower than in other U.S. populations, but the rate of binge drinking and the rate of extreme or heavy drinking is significantly higher than other populations.
Do you know why?
A lot of that, I think, comes from the trauma that the tribal members have experienced, or even that their parents and grandparents experienced and passed on those habits to their children. There were a lot of policies and a lot of things that the government has done over time that really leads to that historical trauma and trying to take away the culture from a population, take away their identity. And when you have your identity taken away and you're not allowed to practice your culture, it's a lot harder to deal with stress and other mental health issues, and you find ways to cope, and alcohol and drug abuse has been one of those ways.
Can you talk about the trauma a little bit more, specific things?
Yeah, so they're everything from, termination of tribes to the relocation of tribal members from their reservations to urban centers without support. Also the boarding school movement. The boarding schools were a big piece of that, where kids were taken from their reservations and put into boarding schools, and they witnessed atrocious things. There was rapes, there was physical abuse, kids were dying. It's really traumatizing for people, and even if they survived it, they still had to experience that, and they learned those behaviors, and oftentimes would continue those behaviors when they got back home and with their kids. And so we see that the whole concept of 7 generations. Everything that happens today is affected by what happened 7 generations ago, and everything that we do today will affect 7 generations from now.
So talk about what specific types of mental health issues you might have witnessed. Depression, suicide.
Yeah. Depression and anxiety are really large ones. Suicide in our youth is still a major problem today, and we're seeing higher rates of suicide attempts in the Native community than we are in some other communities.
Ashley, tell me how you internalized what you were seeing. It obviously made a lasting impression on you because you chose a career path to work on these issues.
Yeah, I think I really turned it into an opportunity to motivate me. I still remember those days pretty vividly. I don't necessarily talk to those family members anymore, but I really did take it as an opportunity to do something with it instead of just keeping it as a negative in my life.
Mm-hmm. So did that mean pursuing a certain line of education?
Yeah, I originally wasn't going to be working in Indian Health Services. I wanted to be a plastic surgeon. And eventually my life led me to health administration and a scholarship with Indian Health Services. And so I had to do a payback with that and work within Indian Health, and really became passionate about it while I was in school and learned everything I could about the system and the disparities that people face.
Is that what brought you to Detroit?
Yeah, I've worked in other urban centers in Los Angeles and for some tribes as well prior to coming to Detroit.
Mm-hmm. And what did you notice? What did you recognize? What can you say about the agency here?
I think Detroit is a really unique location, not only because of the diversity of the natives, but the diversity in the tribes as well. We have a significant portion of tribal members who have their tribal status from Canada, as well as all of the tribes in the U.S. that are represented in Detroit.
Before we move on, can you just take us to the reservation and give us a glimpse of what life there is like? Is it contained? Are the schools and stores there? What is it like on a reservation?
Well, for my reservation, we were actually terminated in 1953. So that was one of the things one of the government policies that came through. They took away the rights of our tribe and our tribal members. So we were no longer a tribe, we were no longer native in terms of the government's view. And so a lot of people moved off of the reservation and had to go find jobs. And so a lot of our constituents or our members don't actually live on the reservation anymore. We live all throughout the United States.
Wow. So when American Indians move into urban centers, what new issues are presented in terms of mental health, physical health?
I think the biggest thing is they don't have a sense of belonging anymore. And I think that's where organizations like mine come into place, because we provide that opportunity for them to come and receive cultural services and be with people who are like them.
American Indians have always faced difficult and unusual challenges, no matter where they live. But living in Detroit or any large urban area presents a whole new set of challenges that have never been fully recognized or met.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services, because we care and you can.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
The Native American population tends to experience a number of chronic related behavioral illnesses. This includes diabetes and depression. Some of this can be historically attached to poor medical services as a whole. As a result, there has been generational development of patterns of diabetes within Native American families, as well as depression. These behavioral results have tended to not be addressed with appropriate interventions, both mental health and behavioral health, as well as medicinal opportunities to try to address the diseases that are incurred.
American Indians have always faced difficult and unusual challenges, no matter where they live. But living in Detroit or any large urban area presents a whole new set of challenges that have never been fully recognized or met.
Ashley, you've told us about your experiences and observations while growing up American Indian in Oregon and some of the mental health issues that you observed. Now that you're in Detroit, can you tell us some of the specific issues that the American Indian population here is dealing with?
We're seeing a lot of co-occurring issues. A lot of the clients that come to our organization are coming for both mental health needs and substance abuse. Every once in a while, we'll have someone who's coming for just mental health, but we really do see a lot of co-occurring and people who are trying to self-medicate with their issues.
So when they come to your center, do you provide therapy, treatment? What services do you provide to help someone like that?
Yeah, so our traditional therapies, in terms of the evidence-based practices that are out there that really any therapist is taught. That's obviously still a part of the services that we provide. But we offer a lot of other kind of alternative or complementary services during our visits. A lot of times we'll offer smudging, which is considered a ceremony, or a traditional practice before we start the therapy session. We integrate a lot of meditation as well. There's been sessions where they have drummed and sang or done any other of the traditional practices as a part of their actual therapy sessions.
Okay, so tell us how effective those are.
I think it's really effective for a lot of people to be able to access the best of both worlds, I guess you can say. We do have some people who come just for the traditional services, and we're okay with that as well. And we have some people who come just for more of the Western medicine, and we're okay with that. We really believe that when it comes to treatment of mental health or even physical health, you have to meet the person where they're at and what services they want and need. And so we take that time to figure out what they want.
Can you give us an example, maybe a case study where someone comes to you depressed, they have anxiety, maybe they're drinking too much alcohol? What Indian cultural services would you provide to help them?
Well, we actually have also a Wellbriety program, which is kind of like an AA program, but it's more walking the red road and the right road, and it's very Native specific. So they have an opportunity to even have a group session that is built on Native principles and the things that we're taught. And so that's one of the first things that we would offer somebody who was going through an alcohol use or drug use problem. In our organization, we have the 7 grandfather teachings that we follow. And so things like love and humility are a big piece of that. And so we teach people how to integrate that into their daily life and how to use those values and those skills to help them cope each day. And then the sweat lodges, I think, are a major thing that we refer people to as well. So it's an opportunity for them to go through a ceremony. And if someone needs some more in-depth conversations or traditional healing, we will help them meet with a traditional healer who can come in and talk with them and maybe even give them some traditional medicines that will help with the things that they're struggling with.
So what's a sweat lodge?
So a sweat lodge is an opportunity to come together in a group and really purify and cleanse oneself and one's mind and body, and to really connect in a spiritual way with the earth and with, it's really a healing method.
And smudging, what is that?
Smudging is when we use the medicines that have been given to us, things like tobacco and cedar and sage and sweetgrass. And we use that to purify our bodies and to purify our minds. We use that a lot of times in treatment, but we use it as staff. Anytime before we meet, we're offering people to smudge and get ready for that meeting and to make sure that we're open and ready to have those conversations.
So when I hear the word smudge, I think rubbing something.
Yeah.
So what is it?
So it's like a bowl, and there's all the medicines are in there and burning, and you're purifying and putting that smoke all throughout your body. And you're not inhaling it, but you're using it to clarify your body. And sometimes people will cover their eyes or their mouth, or I like to cover my heart at the end to really bring that medicine to my heart.
So how do you measure the effectiveness of that?
I think that's one of the things that we really struggle with. You know, the world is so much about evidence-based practices. Traditional medicine is not evidence-based because it's done differently. There is no specific order or way that things are done, so it's really hard to actually study in large enough numbers that can replicate. And that's one of the things that we really struggle when it comes to funding or other issues. It's not like other complementary services where it's done a certain way every time. Each person that comes in does it differently. When you talk about over 560 different tribes, there's a lot of different traditions, and things are done differently and throughout different regions and different tribes.
Mm-hmm. So what if somebody who is not American Indian comes in and requests one of these traditional healing therapies? Can you provide it?
It depends on what they're requesting and also the traditional healers that are coming in. Ultimately, it's up to a specific traditional healer to decide what services they provide and who they provide them to. But most of our services are open to anybody that comes in.
We'll have more when we come back about the unique mental health issues of American Indians. There's so much to learn. Please stay tuned. Welcome to My Healthy Mind,
A show that dares to talk about mental health matters that touch nearly every family. Each week you'll meet guests who share their stories, hear from local experts, and learn about resources that may help.
And so I was in a committee meeting at the House of Representatives when I realized that my daughter had autism.
We need to take the stigma away from mental health issues.
No topics about mental health and wellness are off limits on our show.
Let's talk about it on My Healthy Mind.
Native Americans have a great deal of problem with addiction, and that covers alcoholism, that covers drugs, and we have a very high rate of suicide. So a pipe carrier, he walks this way and he serves the people, and he brings them together for prayer and unity. And it's my pleasure to help those people at the health center and to help the people there on Plymouth Road at the North American Indian Center. And when they call upon me, I go and do what I can.
We're back on My Healthy Mind, looking into mental health issues among American Indians and some of the fascinating therapies being used to treat them. Elizabeth Atkins continues.
So Ashley, when I visited American Indian Health and Family Services in Detroit, I was so impressed by the vast array of services that you provide. Can you just give us an overview of everything that you do there?
Yeah. So we're a basic primary care or family practice medical clinic. And then we have our outpatient behavioral health, substance abuse programs. We also do refer people to inpatient care if they need it as well. We have a youth program where we're focusing on bringing back culture and traditions to our youth to prevent drug and alcohol abuse and to prevent suicide in our youth by bringing back that identity for them. We have home visiting programs where we work with pregnant women and their young children. We have exercise and nutrition programs. Our nutrition programs are also teaching people how to eat traditional foods or how to cook traditional foods and bring that back into their lives as well. And many other complementary services like enrolling for insurance or helping them with housing, all the other things that are needed for an individual. So we really believe in providing the services that they need for whole wellness and not just one specific issue at a time.
And how many people do you treat in a year?
So we have about, between our medical and our behavioral health, about 1,000 patients that are considered active patients.
And if somebody wanted to get your services, what would they do?
They just have to call and set up an appointment.
And where are you located?
We are located in Detroit off of Michigan Avenue, between Lanyo and Wyoming, right at the border of Dearborn and Detroit. So we're in a residential neighborhood. Some people start driving down the street and think they're going the wrong way, but we're right there in the neighborhood and serving the neighborhood that we live in as well.
And do people who are not American Indian come to receive services from you?
Yeah, actually about 60% of our clients are non-native. We actually serve a 7-county area, so people are coming all the way from Macomb and St. Clair and all the way from Washtenaw and Monroe to get services with us.
And how do they pay for these services? Grants, insurance?
Yeah, so if they do not qualify as an Indian Health Services eligible patient, we do take insurances, but we also take people on a sliding fee scale based on their income. And we also help people enroll in insurance as well.
You have cultural programs as well, like powwows.
Yes.
Tell us about that.
Yeah, so we have an annual powwow and health fair every year, usually in August or September. And that's an opportunity for us to bring the community and bring both the Native community and the outside community together to show them our dances and our drumming and our activities. And a lot of times we have our food and our crafts there as well. But we also really use it as an opportunity to provide health screenings. And we've done a lot of our hope and wellness or suicide screenings in these powwows as well.
So you're doing all these wonderful things, but what are some of the real challenges that you face in providing services to a very needy community?
I think the biggest ones, like I mentioned, we serve 7 counties. That's a lot of area to cover. Transportation is a major barrier. So we do actually provide transportation to help people get to our center for services because it's really difficult to get around and get the services that you need. The other thing I think is hard is making sure that people are aware that we're there and what services we provide. It's not as easy to just get a billboard and advertise to all of the natives in Detroit. And like I mentioned earlier, there's no pocket of where natives live. We're all spread out. There is no one part of town that we can go to or one specific organization where we can tell them about us.
So if you could provide a socioeconomic snapshot of the American Indian population in the city of Detroit, what would it be?
There's definitely a high rate of poverty. I think that exists in natives throughout the country, that we see a lot of that. And I think the poverty helps or makes it worse when it comes to the mental health needs and the stresses that they're under. We find that a lot with either mental health or physical health. If they're having a hard time finding food or finding shelter, they're not taking care of themselves, and it's not as much of a priority. And that's why we try to help address those issues as well.
And lastly, Ashley, what advice would you give to American Indians or other people in our community who might be struggling with addiction, mental illness, and just challenges? What's your advice to them?
I think the biggest key is to seek help and to find someone or find an organization that can help you. I think we see that a lot in the Native community. They do have high rates of seeking help, and that really does help get you treatment and help you address the issues that you're struggling with.
Ashley, thank you so much. You've really, really enriched our viewers by sharing all this wonderful information that can help so many people.
Thank you for having me.
Stress, depression, and severe mental illness can happen to anyone. Team Mental Health Services has been helping those struggling with these conditions in southeastern Michigan. Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery. Team Mental Health Services, because we care and you can.
Elizabeth, that was incredible. So many common myths, so many enlightening truths. I don't remember learning more on our show.
I agree. We are so fortunate to have had the opportunity, the insight into learning about our guests' personal stories and the unique stories of their people. To help you in your quest for mental wellness, we've put information and resources on our website, myhealthymind.com. Please take a look. Visiting myhealthymind.com could be an excellent first step toward understanding the unique mental health issues of American Indians.
And we'd also like to hear from you about topics you'd like us to discuss. We mean the tough topics that are so important to talk about openly so that we can remove the barriers on the path to well-being. So reach out to us on our website at myhealthymind.com, on Twitter at myhealthymind, or on Facebook.
Thanks for watching. We'll see you next week for another edition of My Healthy Mind. Now we'll leave you with My Healthy Minute. Let's talk about it.
My Healthy Minute, covering breaking mental health news, legislation, discoveries, and resources.
We launched our signature program, the Tribe to Tribe Blues Community Challenge, in 2012, which brings federally recognized tribal communities together to compete to see which can log the most miles of physical activity over the course of the contest. We also focus on improving the levels of physical activity, reducing health risks associated with obesity and inactivity levels, and improving the overall sense of wellness of the individuals participating. The tribes who complete our challenge at the end receive grants from Blue Cross for health and wellness initiatives in their community. If you're interested in hearing more about the community work done by Blue Cross Blue Shield of Michigan, or specifically the Tribe to Tribe Blues Community Challenge, please visit us at www.mybluesperspectives.com.